So let's talk about fevers in children. Let's say it's 8 o'clock at night on a weekend and your pediatrician's office is closed. And most pediatricians nowadays don't actually have an on call number that you can call for guidance for treating your child when they have a fever. So, what do we actually consider a fever? It's going to be a temperature greater than 100.4 degrees. Anything less than this, you can consider it to be low grade, and we're actually not going to try to treat it because that is the body's natural immune response to try to fight off whatever the illness is. So, the first thing that we've got to do is actually figure out what the temperature is. So the different types of thermometers that we're going to use, birth to 2 months, we're going to use a rectal digital thermometer because this by far in all of our younger children are going to be the most accurate temperature readings that we can get. From 2 months to 4 years of age, still use a digital rectal thermometer. We can also consider an armpit temp, but the armpit temps typically you're going to need to add 1 degree to because it's a little further away from core, so it's not quite as accurate of a reading. You need to wait till at least 6 months of age to use one of the little digital ear thermometers in them. Most kids, by the time they're 4 years old, they can actually hold the digital thermometer under their tongue until they can get the temp reading. So, how do we use these different types of thermometers? If you don't know how to take a rectal temp or never have, it can be a little bit nerve wracking to do. So take your rectal thermometer, turn it on, lubricate the tip of it with a little bit of petroleum jelly, lay the child on their back, pull their legs up like you're attempting to change a diaper, and you're going to insert that lubricated end into the rectum a roughly ½ inch to an inch, and you're going to hold it there until the thermometer beeps. Then you can take it out and read it. When you're doing an armpit temp, place the thermometer under the child's armpit. Make sure that it's touching skin on both sides, that you don't have any clothing that's actually trapped under the armpit and in contact with the device. Then you want to kind of give your child a hug while you're holding that thermometer in place and hold it until it beeps and gives you the reading. Oral thermometers, we all know how to use those. Stick them under the tongue, turn them on, hold it until it beeps, then you can pull it out and read what the thermometer says. Ear thermometers, you're typically, each one of these have a little bit different guidelines, so you need to follow the directions on the box for your ear thermometer. And then the temporal thermometers, you're just gently going to swap them across the forehead and then read the temperature that's on it. So, when do we actually start treating these temperatures? Most guidelines say that we don't treat a fever until it's greater than 102. So, in our different age ranges from 0 to 3 months of age, if they have a fever or a temp that is greater than 100.4, we need to contact our pediatrician because typically we shouldn't see fevers in this age range child. So we don't really recommend home remedies or any types of medications. From the 3 to 6 month old range, if the temperatures are greater than 102, they need to drink plenty of cool fluids, avoid bundling them up in any type of bulky clothing or blankets, because let's face it, it's always, this time of year, fall, winter, when they start running temps and we have them in their fleece onesie and all of these things, this can actually worsen that body temp and cause the fever to go a little bit higher. You can consider temperate sponge baths at the 95-degree Fahrenheit range, and of course, infant Tylenol once they reach this age range, and then contact your pediatrician for further guidance. From the 6 to 24 month range or 2 year range, if that temp's greater than 102, once again, drink plenty of fluids, avoid bulky clothing and blankets. You can consider the sponge bath at 95 degrees, and you can also do Tylenol and or ibuprofen. Contact your doctor if that fever does not respond to the meds or if it lasts longer than 24 hours. From the 2 year to 17-year range, drink plenty of fluids. You can consider temperate baths again at 95 degrees, and give them Tylenol and ibuprofen. So let's talk about giving medications. We need to follow the guidelines that are given to us by our pediatricians and the dosage recommendations on the medications themselves. Anytime that you take your child in for a well check at your pediatrician's office, typically they'll give you a chart and they will write the dosage for each medication on this based on your child's body weight. We're going to give these medications by the syringe that's included in the box of medications. And remember to give it slowly to allow them to have time to swallow it. So if they vomit after taking the meds, we don't want to repeat the medications because we don't actually know how much of it has made it into their system. We're going to have to attempt other means to control the fever, like sponge bath or removing the bulky clothing from them. And we need to wait until the next med administration to give another dose. Once again, these are just guidelines to treat fevers at home. If your child is not responding to the treatments, they're not having a very good fluid intake, they're having less than 4 wet diapers, or they went to the potty less than 4 times in a day's time, we want to consider them possibly becoming dehydrated. We need to seek medical attention for them right away because children can become dehydrated very, very easy. Um, Once again, if the fever is too high, they become lethargic, they're showing signs of difficulty breathing, then they need to see their doctor or go to the emergency room immediately. 6 months up, you can alternate Tylenol and ibuprofen every 3 hours. So we're going to give each medication at 6 hour intervals. So right now, I would give Tylenol, and in 3 hours, give ibuprofen. 3 more hours, give Tylenol again, and then in 3 more hours, give the ibuprofen. Name brand versus store brand on the medications, it doesn't really matter because these are the same medications. If you read on the labels, the biggest thing to keep an eye on are the concentrations and the dosages because infant Tylenol actually has a different concentration of medication to fluid than the children's Tylenol does. So we need to keep an eye on these when we're giving them. Um, this time of year, we see lots of kids get sick, so we need to keep these medications on hand and in a safe place because we don't want to realize at 10 o'clock on Saturday night or Sunday night that our child has a fever of 103, and now we've got to try to find medication or go to a store, find a store that's open, and get some medication to give them. These are just guidelines and they're not meant to take the place of seeing your pediatrician. And if for any reason you're concerned about how sick your child is, take them to the doctor or take them to the emergency room right away. So, once again, thanks for watching. Hope this helps.